Clinical guidelines are important tools to improve the standard of care you receive, and they're not just for doctors. Karen Carey, our Consumer Affairs reporter, has been looking at what guidelines intend to be and how we should be using them.
Clinical guidelines are about bringing together the latest scientific evidence to help clinicians to make the right decisions about how to diagnose, treat and care for people with a specific condition. But they're not just for clinicians, they're for consumers too. You and I, to make sure that we get the right treatment that we deserve. A lot of work goes into developing clinical guidelines. They bring together leading experts, in theory with no vested interests, to summarise the best available evidence. They consult with other experts and hopefully with patients, and then publish the guidelines for all to use. That's all well and good, but the fact is that health professionals are notoriously bad at following guidelines, and that can have a serious impact on the safety and quality of the care that we receive. I asked Michelle Kosky, who runs the Health Consumers Council, by the way an organisation that I used to chair, why she thinks guidelines are not used as much as they should be.
They are problematic because not all the specialists in Australia can sit around a table making up a guideline, and often guidelines are developed but then not accepted by other parts of that specialty. And consumers have no sense of whether their doctor is a guideline follower or a guideline rejecter.
So it's clearly their intention that consumers will access this information and be able to use it.
Absolutely, but the way they're marketed, promoted, distributed leaves a great deal to be desired. The guidelines to the clinical care of early breast cancer, they produced a consumer guide, and it was revolutionary for women with early stages of breast cancer, because they were able to go to their oncologist and say, this is what this book from this authoritative group in Canberra say. Are you following these guidelines? What is it that I need to know to make an informed decision about my treatment and care?
So I guess that's a really important aspect of it. It's not for consumers to be treating themselves. It's really to help them have a conversation with their doctor to ensure that they get the right information and the right treatment.
Absolutely. That's absolutely right.
The NHMRC produce literally hundreds of those types of clinical guidelines, and yet quite often they're not adopted in practice. What are the barriers, do you think, to doctors adopting them?
Well, I think sometimes doctors don't see the experts that NHMRC see as experts as the experts. I think there's tribal warfare in medicine like we can't even imagine, and so if one group of people says this is the right way to go, other people might say, no, I'd go a different way. I think the universities teach medicine in different ways, so that really the guidelines should be attached to medical teaching and training, so that people become acculturated to the guidelines rather than having them imposed on them when they've already developed their styles of practice over many years. It's very hard for people to change their practice, and often the changes aren't that great. You know, they're marginal, but they could make such a difference to a patient.
What way can consumers get real value from guidelines?
Well, I think that if it can inform if they can obtain them, that's great. So I would like NHMRC to set up a consumer website where you can get the consumer guides to every set of guidelines they've produced since 1996. I think that would be an excellent contribution to consumer health literacy, which we know is a major problem in people accessing and understanding their care. So that's the first point. The second point is that once you've obtained the guideline, I think it really assists you in a conversation with your medical practitioner, so you both have a shared understanding of what's wrong with you, what your diagnosis is, and what the plan for your treatment is. I think that's absolutely critical to good partnerships in healthcare. And thirdly, I think it standardises practice, so it reduces variations in practice, so that consumers can be confident that if the doctor's following the clinical guidelines, they're getting the best care and the safest care and evidence-based care.
It's quite interesting. Consumers often think that a doctor is a doctor is a doctor, and if you go to one doctor, you'll get the same treatment as if you go to another doctor. But there's actually quite a lot of variation between practice, isn't there?
Absolutely. And as I said earlier, universities teach medicine in different ways. Surgery taught at one university might be taught quite differently. I would have thought that a greater standardisation would give people more confidence in the procedure that they were going to undertake.